The common question that people ask is, what is the difference between a psychologist and a psychiatrist? A psychologist does BA, MA and MPhil as well degrees. A psychiatrist is a medical doctor who undergoes medical training in MBBS, MD and does DM as well. Say for example, there is a small boy is there, who goes to the school on a daily basis, but on particular day he has some issues at school, someone is bullying, say for example, and then he doesn't feel like going to the school the next day. So, how to solve this problem? Or the student is feeling stressed. So, how do we get about it, and whom do we refer to, or whom should the parents go to? Typically, if they go to a psychiatrist, a medical doctor, he assesses, he asks the antecedents questions as to the previous, is there any previous history of the boy being decompensated behavior, or any issues with the parents at home, or different issues at school, say the teachers, as well as does he have any problems with the friends, peers or classmates. And after assessment, if the psychiatrist feels that the patient has, or the child is suffering from depression or severe anxiety disorder, and there is a pervading decompensated behavior, then the psychiatrist treats the patient as well, or the child. But if if the behavior is completely normal till that point of time, if the child, but only on those particular week or particular day the child has decompensated behavior, then the psychiatrist will refer the child to a psychologist for counseling the child as well, and to what is called as behavior changes, modifications, he may refer the patient to a psychologist. Now, suppose there is a patient with alcohol addiction, or say addiction disease, say gambling addiction or internet addiction or games addiction. Nowadays people are more attracted towards smartphones, and then they are addicted to smartphones as well. They need to go to a psychiatrist first. The psychiatrist then treats the patient, assesses the patient for the addiction disease, and for how many hours the patient is spending and how much money he is spending on that, and what is his decompensated behavior, to which activity is overtaken by this addiction disease. So, after assessing in detail, then the psychiatrist will treat the addiction disease with medications as well, with therapy as well, what we say as psychotherapy. But initially the patients may not be motivated enough, then the psychiatrist will refer the patient to a psychologist for what is called as motivational interviewing techniques, we say, wherein the patients get motivated, and then to pursue the treatment and follow the compliance with the medications and the treatment which is prescribed by the psychiatrist.